we as social scientists, we are looking at perceptions of aging in the eyes of the elderly, in the eyes of the older persons, and as well as in the eyes of other people, other stakeholders. The themes that we looked at were healthy aging, we looked at roles of older persons, we looked at lifespan over the years, we looked at challenges of aging, the needs of older persons, and many other themes, but all were perceptions, what the older persons and other stakeholders perceived. And the physical perceptions of aging pointed to physical fitness. If you are physically fit, then you are aging healthy. Then there was also absence of disease. Absence of health challenges was also a finding that came across different stakeholders. Also, good physical appearance outwardly was perceived to be healthy aging. And thinking clearly, others termed it as thinking straight. It was it was under physical perceptions of aging. Then when we came to emotional or behavioral perceptions of healthy aging, leading a stress-free life was the most outstanding finding. And this stress-free life was attributed to aging as you have people around you to take care of you, to nurse you when you have health challenges, to give you good nutrition. Then there was the third category was of socioeconomic perceptions. And these were mostly having a social and economic stability as you age. You have stable finances, you can take care of others, you can take care of yourself, and you even have your own home. That was under social and economic stability. We also had a finding on accessing medical services. If you are socially and economically stable, you should be able to access medical services, and that implies healthy aging. We also got a finding on ability to plan for the future. That also fell under socioeconomic stability. So once you are still young, when you are still young, you should be able to plan for the future, and that will have implications on aging healthily. And the last finding on socioeconomic perceptions was on engaging in social networks. When you interact with others in social networks, it boosts your esteem. And if you need any help, you can be financially assisted because of these networks. Spirituality also came up. Spirituality instead was presented as a result of healthy aging. If you are aging, if you age healthily, then you are able to go wherever you want. And among the places they mentioned was going for prayers. They didn't tell us going to the market or what, no. So, which means spirituality is a strong outcome of healthy aging. They were extremely happy. It was like they had never got visitors of our kind to talk to them. And this enabled them to open up and tell us all about themselves, what hurt them, what made them happy, the challenges they have been able to experience. as they age. So to me, it was something unusual because I've interacted with all kinds of people in the field, but I'd never seen people so happy to see interviewers come to them like they did. The most surprising thing was about the finding of knowledge about changes or the process of body transformation, associating it to healthy aging. It was a unique finding, and it came out. So if you know that as you age, at a certain age, for example, for women, you have to go through menopause, this is what happens to your body. So the knowledge that, oh, this is happening to you, as long as you know that this is what is supposed to happen to you at this age, then it will help you to go through healthy aging process. Unlike someone who is so ignorant about what is happening to her body. The next steps, I would say, would be to get recommendations from the different themes, not only the qualitative theme, because we had numerous themes under the qualitative part of the project. Get recommendations even from the phenotype, from the demographers, from the artists, then put them together and reanalyze them and sieve out what is relevant for policymakers. Then that will give us direction. And it will be, I think, the main outcome of the project. If we are able to influence policymakers, then that would be a plus. Then the second is to carry on, to replicate the project in other cultural settings, because where we were in Busukuma, the culture is different. So if the project is replicated in another culture, in another district, in the deep rural areas, because we are in a peri-urban setting, the findings would definitely be, it's likely, not definitely, it's likely that the findings would be different. And then we can get even more recommendations for policymakers, because we cannot bracket everything that we gathered to apply elsewhere.